this is our last session for today. We're going to summarize and summit the speakers and the sessions for today. And we're going to do it with these people on stage and the person behind you on the screen. So we'll start with Dr. Bushra Kadora. Thank you so much for your previous session today. And we have also Dr. Kevan Yamanshire. Thank you so much for your two presentations. And we have Anthony Abusay. So, what we have done here today is that we have been focusing on prevention, how to prevent diseases. And so this is our main focus actually now. We're going to talk here for maybe 20 more minutes. And I'm going to ask Dr. Bushra Kadora first here. Why is prevention so important?
You mean intervention or prevention is so important?
I'm talking about prevention and also interventions to work with prevention. Why do you see that so important?
Well, I can talk in early years, and I'm talking, and that covers the range of children from birth to 8 years old. And it is the intervention is actually comes before to prevent. The importance is that these children, the babies of today or the children of today, are going to be our neighbors tomorrow. They're going to be the people that we work for, or they take care of our economy, and they take care of our industry. And if they are not balanced, and if they are not ethical, we are going to have a big time, a hard time, because they're going to be caring for us. So, and they're going to be leading our world into the whatever, the future, or they're going to be running that. So, if we look at today's need, what we need for tomorrow for these children to be leaders, and we implement and I think the pandemic has shown all the world how mental health and resilience and well-being is important to the survival. And I'm talking also for being successful in the future, but I'm talking again, I will stress again that for the survival of our species, for the survival of humanity in the future. So mental health was not that important before the pandemic, or about 20 years ago. But today, especially today, and with all the disruptions that we're having in the world, it has become crucial, because we do need the resilience to face what the unknown that we are going to be facing, and we need the health and the well-being to keep ourselves sane and not become a useless society, as Yuval Harari says.
Thank you so much, Dr. Kadora. We're going to let Dr. Yamanshire come into the presentation, or to this little, what we can call a summit or talk show or panel discussion. You have been talking, you have had two sessions today. The last one was about dementia, how to prevent dementia, connected to lifestyles. And earlier you talked about, this is what you actually do when you go out to school and teach students. You are a doctor, medical doctor, so you meet patients when they are sick, right? But you're here today to talk about how to prevent diseases. So what's your point on that, and why is it so important for you?
Well, thank you, Robert. Hard question, but it is very important, and that's because, as you mentioned, I meet people who are sick, and we know that we could prevent a lot of these disorders, because once they come, and basically for every disorder, there is prevention that comes from healthcare, and that is information about their disease, their body, and their health, how to reduce alcohol, drugs, and tobacco, and have a healthy lifestyle, eating properly, physical activity regularly. And the sad thing is that we most of the times don't have the resources, but a lot of these cases, like high blood pressure, heart disease, they are due to an unhealthy lifestyle. And we could have easily prevented a lot of these if they would have had a healthy lifestyle, if they would have had information about lifestyles that are good. And thus we would have seen a lot less sick people. And the importance is, of course, we prevent disease, we prevent damage, but as we get older, we will get more sick people. We are a growing population, we will get older. My daughter, who was born last year, she would probably be 100 years, and her daughters would probably be 120 years. And we need to prevent that if they survive the global environment thing. But we need to help them to live a long life, and that is through early on interventions and prevention. Thank you.
Thank you so much, Dr. Yamanshiri. Anthony, you have been talking today about prevention as well, actually. And you are also sharing a great story. What's your point of prevention? And while you are working with teenage children, why do you see prevention is so important?
First, at what we do in prevention, mainly at Mentor Arabia, is based on evidence-based. It's based on evidence coming from UNODC, Universal Drug and Crime, from the United Nations for Drugs and Crime, and Universal Prevention Curriculum, which is the ABC of prevention. Then what we do is not saying for people that we want to scare you about drugs, or we want to teach you how you take drugs or how you do risky behaviors. We do empower them through empowering their life skills. And the United Nations for Drugs and Crime says that $1 spent on prevention saves up to $10 in the future health, social, and crime field. Then the prevention is super important, because when you are preventing someone from going into risky behaviors, you are not just telling him that you don't have to go here. You are empowering their skills. In that way, they will be empowered on all levels. Then it will support them in overcoming any challenge related to anything from their internal environment or their external environment.
Thank you, Anthony. Let's go back to Dr. Pushakadora again and see. Let's jump a little bit here from prevention to mental health issues, because you were talking about the crucial situation here during the pandemic, and now maybe more or less after the pandemic. What's your point here? What do you think we have to do right now to prevent that situation we have right now in the world?
I think we still have a chance today, because, as I said again, there is a huge interest in early childhood education and care, and this is the only area where they've been implementing now, I think, as a holistically integrated. That means our social, emotional, and cognitive development altogether. And I think today is very important. We have a chance, because we, as Anthony said, we know how effective is investing in early childhood education and care, and also in prevention. Why? Because all the evidence we have is that 70% of of our development happens in this period. So if we can now instill the skills that we need, especially as I said again, I stress and I stressed again, the mental health intervention or the mental health program, which I'm talking about resilience, I'm talking about well-being, I'm talking about emotional satisfaction. They are not going to make the people happier, but they will help this generation to deal with the unprecedented changes that we will face tomorrow. We don't know what our world is going to be tomorrow. Do you know? Does anybody know what kind of jobs, what kind of parents? Are we going to be fully organic humans? I mean, with the AI, they're talking about a new species. So it's not something easy. What we need to do are two things: make sure that we can resist or we can face these challenges through resilience and well-being and taking care of ourselves. And second is to really relearn and learn and learn sort of reinventing ourselves in order to keep up with all the disturbances that we're having and the technological advances that we have. Now we know, I think we know, we are sure that as a health-wise, clinically, we are going to be in a better world, especially with all the technology, health-wise, regarding the diseases, what we know about the brain. But we will not know, we don't know about the mental health, how you think, yourself, your thinking, your emotions, how do you deal with depression? This is what we don't know yet. And we really need to make sure that we understand and we build prevention so that we build interventions and programs to strengthen these skills so that we will not be later on dominated by the technology, you know, um, we will not be like now. What we have is the social media and all these. As I said, my granddaughter was talking about ghosting. She's 12 years old, and I didn't know what ghosting was. Ghosting apparently is they ghost you out of their social network, so you become a nobody, and then youngsters are committing suicide because of this. So this is what we need to really empower our children with these skills. And that's why mental health before education, before social health, before all of these is very, very important.
Thank you. Okay. Thank you so much again for your insight and for your remarks. We have a few minutes left. We do take questions from you if you have a question. But I'm gonna let both of you here on stage, give a couple of comments as well. I go again back to Kevin. Uh, do you have anything special to add right now? If you want to sum it what the previous speaker said?
No, but what I thought about is we talk about prevention, intervention, going out early on and forming people's lives, giving them support. And just like Dr. Bushra mentioned with the pandemic, one thing that we're not allowed to forget is that by people feeling worse, more mental illness, it actually goes down in age. A child who has a parent with mental illness will also be mentally ill somehow, or at least be affected. What we established by going out early on with primary prevention is actually also to find people who at an early age has mental issues, something that's disturbing them, catch them, showing them that what they feel is natural, why they feel what they feel, and where they can look for help. So even though we talk primary prevention, the primary prevention could in many cases be the first step of catching something before it goes even worse, before it progresses too long.
I agree with you. Totally. Thank you.
Thank you.
Anthony, the last remarks will come from you.
As we are talking about the pandemic, as I do work with youth, I want to say that it's really important not to exclude youth from their communities, specifically with the pandemic now and the time that we spend at home. It's really important to use to take the precautions, but at the same time to engage our youth to work in community work, to be engaged to make activities with their friends, taking into consideration the pandemic. But these skills like team building, conflict resolution, communication skills, these skills should be practiced with others. And that's why it's really important in that period, taking into consideration the circumstances, to support our youth to be engaged in community service, to be engaged in their communities, with their friends, their environment, and interact positively with their environment.
Thank you so much. I want to thank you all here and back there. It was actually a pleasure to have you here the entire afternoon from 1 o'clock till 4 o'clock. It was great presentation. Let me have the last word here. Take this opportunity and talk to all of you here and say that our message that we want to send to all of you here and to those who are watching this event is actually that if we continue to not focusing on prevention, only on diseases, if we only help the people that get the disease and not prevent the diseases, the problem will be that we will have more people that will have different diseases. So the deal here, if we're going to succeed, is to focus more and prioritize the prevention part so people will not develop diseases. All right. So once again, thank you so much. And if you want to hear more about us, you're so much welcome back tomorrow at 2 o'clock. Choice Foundation and Mentor Foundation and Mentor Arabia say thank you so much.
Thank you.